What would you do knowing that you are responsible for making 20 to 30 people sick with the flu? And would you change something if one of these people happened to be your child, your husband, your friend, your parent, or your co-worker? Hello, my name is Francisca Minu, and today I am here to persuade you that every healthcare worker needs a mandatory flu shot. Before I proceed, I would like to throw a little light into the influenza virus. According to CDC, influenza is a contagious respiratory illness that can cause mild to severe illnesses, sometimes resulting in hospitalization or even death. So we are talking about 30 to 50,000 deaths in the United States annually. So who is more vulnerable to influenza? Some people are more likely to develop severe illnesses from the flu, especially people aged greater or equal to 65 years, children aged less or equal to 5 years, people with high-risk medical conditions, and pregnant women. This is the image of the flu virus, and you can see how complicated this virus is. And this chart here is a historical influenza outbreaks from the past, and you can see how many deaths were reported. So, why is it necessary for healthcare workers to get the flu shot every year? Healthcare workers are at risk of occupational exposure due to contact with patients who may carry the virus. They may act as vectors for the transmission to vulnerable patients. Self and family protection, awareness of the severity of influenza, complications and efficacy, protection of patients, avoiding absenteeism, which is at 20%, and serving as role models. Staff shortages during influenza outbreaks, which leads to heavy workloads, longer wait for patients due to staff being out with the flu. So someone may ask, why can't we get vaccination against flu virus once and for all, just like other illnesses? That is a very good question. But due to the influenza virus potential to have several dominant strains, it is impossible to develop just one-time vaccine against it. So every year, around February, new influenza vaccines are developed to be effective against the expected dominant strains around the world from a network of reporting sites. These reports are used to generate a recommendation for the vaccine combination for the following winter. These recommendations are used by vaccine manufacturers to formulate each year's vaccine. There are two mechanisms by which these evolutionary changes may occur: antigenic shift and antigenic drift, which the drift is less serious and the shift is more serious, which probably leads to epidemics. So what makes people decline flu shots in the first place? Some people are concerned about side effects of the vaccine, about the allergic reactions, infections from the vaccine itself, about pain at the injection site, doubt about efficacy of the vaccine. The above concerns are less serious, if any, than the seriousness in getting the influenza virus itself. I understand people have so many excuses for not getting the flu shot. I know a family member who once told me that flu shots make people sick. After giving her first shot in 2013, she never stopped getting flu shots. So the flu vaccine is in a way that people who even have allergic reaction to the dark eggs have a different way of getting the flu shot without any allergic reactions. So this is the image that the CDC normally puts together to show us how the flu virus works. To be host specific, we have avian, swine, and mammalian strains. So these are different strains of the virus that sometimes make it very difficult to find the exact vaccines that fight against it. If you look at this diagram here, you don't really have to touch the avian itself to get the flu virus. You can actually touch the virus by touching your face and your nose. And this is explaining this diagram over here. So these are the three major groups of influenza virus in this chart here. So we have influenza A virus, the B virus, and influenza C virus. So among all these three, the A is the most severe virus. Now, if you do get the flu, the signs and symptoms to look for. Influenza infections are most typically characterized by fever, chills, and body aches. This followed by symptoms similar to the common cold that may last a week or more. The treatments. 3 drugs that inhibit influenza neuraminidase activity are available. The one that you can inhale is the zanamivir. The oral one is the oseltamivir, and the intravenous one is peramivir. If taken at the onset of symptoms, these drugs can shorten the course of the disease. However, the more effective means of controlling influenza outbreaks, though, is vaccination. In conclusion, the most efficient strategy to prevent a significant number of influenza infections is annual vaccination of healthcare workers, which is associated with reduction of morbidity and mortality among patients as well. Wouldn't you like to use your PTO for an amazing getaway rather than spending it for the flu? How about those of you who do not have any PTO? Are you going to stay home with the flu and not get paid as well? Well, the only effective way of preventing all this is to get the flu shot every year. Today, as the clinical coordinator of flu clinics and wellness, we have well-trained nurses outside this door offering a free wellness check and a flu clinic. Please feel free to stop by. Thank you very much.